Hi, my name's Lyndall Trevena. I'm Professor of Primary Healthcare at the University of Sydney and one of the Chief Investigators of the Ask Share Know Centre for Research Excellence grant. This short video aims to give you some idea of how to use patient decision aids that have been developed for the non-surgical management of osteoarthritis of the knee and hip. We've developed these tools in collaboration with multidisciplinary teams, and they're designed to summarise the evidence based on the recent College of General Practitioner guidelines in Australia. Think of them as a framework to help structure your conversations and help you to explain the options and involve your patients more in making decisions about how to manage their knee or hip osteoarthritis. So I'm going to focus on 3 types of talk based on the 3-talk model that was published by Glenn Elwin in the BMJ in 2017. I think this 3-talk model gives you a good framework for structuring your conversations with patients in using these decision aids. The first one here is team talk. Believe it or not, sometimes you actually need to let patients have permission to be involved in decisions. You need to actually set out the fact that there is a choice. There are a number of really good treatments, and there's no right or wrong. We really just want to make sure that we get the right decision and the right choice for them. So it's really important that you open your conversations with patients, inviting them to be part of the discussion and actually setting out that, in fact, you're partners together in making decisions about their healthcare. This is new for some patients, so you might need to spell it out. The second type of talk is option talk. So option talk is really setting out the options for patients, but also what the benefits and the harms of those options are. And it's also really important to give them an opportunity to indicate what's important to them, what their personal preferences would be, because we know that if patients choose options that better align with their own personal preferences, they're more likely to actually implement that decision. Now, let's take a look at these patient decision aids and see how you would use them. So there are actually a number of pages, a series of patient decision aids for knee, and very similar set for hip osteoarthritis. A reminder that these are for non-surgical management options. So this is not somebody who's thinking about having a knee or hip replacement operation. So the first page is actually an overview, and it may be that you might want to start giving people a context for the sorts of different options that they can have for treating their osteoarthritis. This one here is for managing knee osteoarthritis, but the hip one is set out the same way, just that the evidence is slightly different. So you'll see there are 4 columns here, and so these are the 4 sort of main types of treatments that we would use for managing knee osteoarthritis without surgery. So there are exercise options, there are weight loss options, there are physical and psychological options, and there are medical options, which are mainly to do with medication. So sometimes if you're the first person seeing the patient as part of the team, or perhaps you're their GP, you might want to give them an overview. And all of these decision aids are set out in the same way. The ones that we'll follow, that we'll go through, actually just have more detail about each of these particular groups of treatments. But it's often quite useful to hone in on which one is most important, or perhaps which one is most relevant to your own healthcare. Let's imagine that I'm a physio and I'm meeting this patient for the first time. I may want to tell them that there are a whole lot of other treatment options that other members of the team will be talking to them about, but because I'm a physio, I'm mainly going to be focusing on discussing the exercise options with them today. Same may apply if you're the dietitian. You may want to focus on the fact that it's the weight management options that you want to focus on. Similarly, you can cross out some of these if they're not relevant. Let's say your particular patient has a healthy weight for their height, or perhaps they're already well on track to losing weight with something that they're already doing. You may want to actually cross out the weight loss option and say, well, we're not going to even worry about talking about that today. And you may also want to annotate this by saying, Well, perhaps we will talk about the medical options, the drug management, when you meet with Dr. Smith, the rheumatologist, next week. So you can use this in whatever way you like. It's flexible. There's no prescriptive way to use it, just a cheat sheet to help structure your conversations. Each of these sheets, though, will have the options, and down the side here you'll see there's a series of questions, frequently asked questions. The top column will generally set out what those options are, and then you'll see the benefits and the harms to follow. Okay, so that's the overview decision aid. Let's take, because I'm going to be the physio today, let's take a closer look at the options for exercise. Now, if I was explaining these options to the patient, I'd try to make it very clear that these are all good options. These are only the ones that have been shown to be effective. But what we've actually done at the top here is show that on the left-hand side, generally speaking in these tools, you'll see we have strong recommendations and then conditional recommendations down here. So the slightly more effective ones, the ones we more strongly recommend are to the left, and perhaps over to this far end here are the ones, they also work, but perhaps they're a little less strongly recommended. And I would normally, after explaining to patients that these are all your options, so in this case we have Tai Chi, walking, we have muscle strengthening exercises, we have stationary cycling, yoga and water-based exercises. I would often then give the decision aid to the patient, having explained how it works. And it's often very useful for them to actually read through the explanatory text of what those options are. You may want to also give them a pen, and they may say, oh, I really have tried yoga before and I can't stand it. And they may actually cross that out, or they may circle things that they like, encourage them to interact with the tool. You may also exclude some that are either not available or not suitable. Water-based exercises may not be appropriate for somebody with a medical condition like a major skin disorder, for instance, so we would be perhaps ruling that out, just as we did on the other one. Patients can also indicate what's important to them in terms of side effects, harms, benefits. They may be really worried about particular side effects happening. And quite often they will have tried many of these things in the past and been able to use this tool to tell you what their experiences have been before. So that's the option talk. The final part of the 3-talk model is decision talk. So by now you should have a bit of an idea of what's important to the patient, have discussed the benefits and harms, and be hopefully coming up with 1 or 2 things that look like something that they would like to give a go. So you make the decision together, and they may choose more than one thing to focus on. But having done that then, making that decision, discuss with them how you can help to actually implement that. Are there certain things that need to be put in place to do that? And it may be that you'll refer them on to other members of the health team to discuss other parts of the treatment and using other parts of the decision aids. So that's pretty much it. Just to recap, you've got 3-talk model, you've got team talk, option talk, and decision talk. Hopefully you've got an understanding of how our patient decision aids work that are designed to be used in the consultation between team members and with the patient as a partner. Just a couple of other resources to flag for you if you need them. On our website we've also got a list of particular treatments that are generally either not recommended or have a neutral recommendation. In other words, we don't really have enough evidence to say whether they work or don't. Patients will often come forward with questions about some of these other treatments, and it might be useful to have this list handy as well. We've provided this at the request of the healthcare providers we've worked with in developing these tools. There's also a supporting document with lots and lots of information about behind the scenes and how this has been developed and why certain things are there, and that can also help you if you have further questions. So in summary, We hope that you'll find these patient decision aids for non-surgical treatment of osteoarthritis of the knee and hip useful. We'd love to hear your feedback on them. If you'd like to be able to download them off our website, go to www.askshareno.com.au and look at the resources section under the musculoskeletal page. Thank you.